Welcome to our BBMRI-ERIC ELSI webinar series. We have today a wonderful guest, Alessandro Blasimme from the Department of Health Sciences and Technology, Health Ethics and Policy Lab from ETH Zurich, from the Swiss Federal Institute of Technology. And the topic of today is future-proofing biobanks governance. Alessandro also has a paper under the same name and a lot of data to talk about biobank governance, COVID, and I'm sure many other things. We will tackle the webinar as usual, up to 45 minutes presentation and then a question and answer session. I'm really looking forward to the talk and thank you again for agreeing to being here today. The floor will be shortly. The floor will be shortly yours. Alex, okay. Please change the slides, the presenter mode.
Here we go. Can you hear me?
Loud and clear.
Okay, good. Good. So thank you very much, Michaela, for your nice introduction. Thank you for having me here, and thanks to all the people who are attending online due to the current circumstances, of course. First of all, I wanted to express my gratitude to Michaela, who reached out to me for this seminar. It's a great pleasure for me to interact with the BBMRI. When I was just out of my PhD a few years ago now, my first postdoc was in Toulouse in the team of Anne Cambon-Thompson, and there I had the privilege, so to say, to witness the first steps of the BBMRI-ERIC, and so it's really a pleasure for me now to speak to this audience and to interact with you guys. I'm also happy that the work we are doing here in Zurich at the Health Ethics and Policy Lab can be of relevance for you, and I very much look forward to continuing these discussions and interactions with you all. As Michaela was saying, the topic of my talk today is biobanks governance. There is the word future in my slides as well, because what I would like to do is to try to sketch out what I think is the, let's say, evolutionary trajectory of biobanking. And I'm sure that you in the audience will have your own views on that. And I'm looking forward to questions and comments about this. This particular talk is to a great extent based on a paper published in the European Journal of Human Genetics that has been, I mean, traditionally a forum for the biobanking community to discuss ethical, legal, social implications of biobanking for many years now. So we were particularly proud of joining the conversation on that journal and joining the conversation with this broader community. What I'm gonna do today, if I manage to move my slides, okay. So I would like to say in which sense I see biobanking on an evolutionary trajectory, which will allow me to digress a little bit on the potential role of biobanking in the current pandemic times, and possibly even more in the future when hopefully most of us will be vaccinated and the crisis will be behind us, but we will still have to deal with the complications of this new normality. Then I will dive a bit deeper into the results of our study on biobanks governance structures and governance mechanisms. And then I would like to briefly say something about another line of research we're developing in our lab, that is our work on new models of oversight for health-related research. Our framework is called AFFIRM, and I will explain what this acronym stands for later on in my presentation. I hope to receive some feedback from you as well, although this part of the seminar today is going to be arguably a little bit general. Then I would like to share with you some concluding thoughts, some concluding reflections about how I think the experience of the biobanking community and the extent to which it has created a reliable governance platform for these very complex activities can be the premise, so to say, for future development. So this is a standard definition of biobanking. You don't know me to introduce you to the topic, of course. This is from the Swiss biobanking platform that, if I'm not mistaken, is also part of the BBMRI family, which describes a biobank as an organized entity with governance in place responsible for the management of biological resources. This is a correct interpretation of what a biobank is, and it's actually nice because it stresses the importance of the management and the governance of biological resources. Of course, the governance is not a clear term per se. Many people use it in a sort of an informal way or as a kind of jargon, and I will try to provide a little bit more on these later on. But I mean, for the time being, we can say that governance is a term that encompasses all mechanisms and structure that allow an organization to exert control on its operations, so to say. So governance goes beyond mere compliance with legal standards and with legal requirements, and usually extends to a widespread array of actors and institutions that, so to say, commonly bring about these controls and this channeling of an organization's activity, normally with the aim of meeting societally relevant ends, which in our case is, of course, the advancement of health-related research and the advancement of medicine. But most of us are familiar with the fact that there is a lot more that can be said about biobanking these days. And I want to stress two elements here. First of all is the growth in size, in volume, the sheer amount of biological resources that become available for researchers is growing constantly. And alongside this growing trajectory, another element that keeps biobankers busy more and more is data. So biobanking is not just about keeping biological resources in refrigerators, but actually it's increasingly so about curating those data, those samples in terms of making metadata available, but also storing and sharing health relevant data that can be associated with biological samples, but need not to. A few examples here that we are all familiar with. The UK Biobank belongs to, let's say, the league of the large-scale national biobanks. We have been all following what happens in this particular case, in this particular biobank, because to a certain extent it's a trendsetter for similar initiatives in other countries. But I just wanted to put up these couple of recent papers that describe how biobanking is increasingly, that demonstrate how biobanking is increasingly engaged with biological and biomolecular resources, of course, but also with data and information. In this case, it's phenotypic data and genomic data, and here it's about images. So data is just as important as biological resources for especially large-scale biobanking initiatives. Another case in point, of course, is the All of Us research program, this cohort of 1 million American individuals that the NIH is trying to put together. I think it's a very interesting case that shows clearly that biobanking is primed more and more towards the integration of biological samples and participants' data. In the case of the Precision Medicine Initiative, that is, let's say, the big policy initiatives by the late President Obama that gave impetus to the creation of this cohort. The idea is that there is an increasing amount of data being collected about research participants, from health surveys to physical measurements, electronic health records, and also data contributed by participants themselves through the use of mobile and digital devices like smartphones or Fitbit bands, for example. Then, of course, there are data in the form of health surveys, but also more healthcare system-related data like claims and so forth. What is interesting here in this case is that the aim of the initiative is not only to improve health research and to accelerate health research, to create new, more precise diagnostics, prevention strategies and treatments, but also to give something back to research participants, which is, of course, very relevant from the point of view of ethics of ELSI in general. The aim of the All of Us cohort in the US is to return data and research results to participants, to provide pharmacogenomics information, and also to give back information related to highly penetrant and actionable genetic findings. So basically, the 59 ACMG genes are tested routinely, and they calculated that on a prospective cohort of 1 million people, they will give results, actionable genetic results, back to around 30,000 people. So, of course, there is a huge ELSI infrastructure that is being created around this. And I think that this is a pretty remarkable illustration of how the world of biobanking is evolving. It's incorporating not only new scientific resources, but also partially new. Of course, we've been discussing these issues for a long time in the biobanking community, but new aims and new purposes for biobanking activities. Of course, this applies also to BBMRI. So what is interesting here, this is a rather old paper, I mean, it's 5 years ago, by the BBMRI, Eric. And you see that I just want you to focus on the title here. This paper actually stresses the importance of biobanking and the importance of BBMRI for the development of new drugs, basically. A few years later, so actually a few months ago, there was this other paper by Michaela, by the way, and colleagues that I read with a lot of interest about the potential role of BBMRI in the current crisis linked to COVID-19. So the idea that a network of biobanks like BBMRI can play a role on in the way we store and make available biological resources and data as well about the pandemic. So here, in this case, the biobank acquires a public health function, so to say, which was not entirely extraneous to the world of biobanking beforehand, but now really comes to the fore. So let me digress a little bit, as I said at the beginning, on COVID-19, just for a couple of minutes. What is interesting about COVID-19 is that it basically accelerated all of a sudden a number of tendencies that were already sort of in place, in particular about the digitalization of healthcare and the use of digital means and big data to try to contain the spread of the pandemic. In particular, if we look at one highly discussed theme in the last few months, even in the popular press, digital contact tracing, normally done through smartphone apps, has been one of the ways in which novel approaches to big data have been attempted in order to contain the virus or the effects of the virus. The debate on this topic has been mostly on technological design, to some extent on data management and data storage, but actually with a lot of gaps in my view. So first of all, there has been very limited attention to the policy side of digital contact tracing. So what kind of policy patterns have governments adopted to embrace this technological turn? And now, under the aegis of the World Health Organization, our lab, together also in collaboration with the Berman Institute at Johns Hopkins, is trying to understand a little bit more about the policy aspects of digital contact tracing. On the other end, there was also quite little attention on governance and oversight aspects of these massive data collection activity that goes under the name of digital contact tracing. And just I wanted to point out a few remarkable features of this data collection activity. So first of all, it required the creation of ad hoc infrastructure. So basically, all the data that are used for digital contact tracing reside on an infrastructure that was built for purpose, or at least was not previously intended for health research or for public health purposes. It's basically enabled by, especially in its European version, it's enabled by Google and Apple, so by private entities. It's premised on what also the GDPR in Europe prescribes as a risk reduction principle, that is data minimization. So you collect only the minimum amount of data that you need for that activity. And the main concern in this respect has been privacy. So you already noticed that some of the themes that we are familiar with within the biobanking community are, let's say, not being discussed. So, for example, in particular, the issue of making data available for further research purposes and making data shareable and accessible for research purposes. This is completely out of this debate. Here on the left, there is a paper that Effie, Vayen, and myself have published on this specific governance and oversight aspect, for those of you who might be interested in this topic. But also, we see that the phenomenon of digital contact tracing is evolving. This is another study that we have in our lab. It's underway. I won't say too much, but the point is that it seems that we are becoming more aware of the fact that we need more than what data minimization allows in order to really effectively contain the spread of the virus even through digital contact tracing. On the left here, you see a poster that those of you who reside in the UK might have seen in person. It's a check-in QR code that is basically being used by the NHS to map where the virus is spreading. It's a clever design because it doesn't require additional data, too much additional data collection, but yes, I mean, this is a novel feature of digital contact tracing. Now, why do I put this up? I mean, it looks like a digression, but actually what I want to say is that we are realizing, even if we focus on privacy as we have to do, and if we focus on informed consent as we have to do, we are coming to realize that the data that we need to effectively contain the spread of the virus maybe is larger than what we have now, and especially we need accessibility to these information, to this data. This is why I found the paper by Michaela and colleagues that I put up before particularly interesting, because this resonates with my view that we have a long way to go before we are able to actually have all the biological resources and the data pulled together in an efficient and accessible way to effectively fight the war we are trying to win. This is particularly important in light of the let's say biological evolution of the virus, the emergence of more dangerous variants that will likely require genomic surveillance. So the systematic collection of biospecimen, the sequencing of virus, and the accessibility to this kind of data in order for researchers to actually understand how they spread, what their effect is, and how they are to be counteracted. So basically what this little digression shows is that there are a number of ELSI trade-offs. On the one hand, we have focused on technological design, while probably we should be thinking about a durable infrastructure for data. We have focused on data minimization, which is an interesting principle and we should respect it, but we also have to think about how to make the public health response more efficient. And we have focused a lot on privacy, basically forgetting about data sharing in this context. So let me go to the study that gives the title to this talk and see how it relates to what I've been trying to say. So our starting question with this study was whether biobanks governance is ready for what's coming. And in these last few slides, I tried to illustrate what might be coming in the direction of biobanking. This work is part of validating our oversight framework called Affirm. And I will say a few words very briefly about that later. And it basically consists of an empirically informed analysis of the governance mechanisms that a sample of biobanks across Europe and Canada adopt. And yeah. So what we did, basically, we tried to map out the terrain first by trying to gauge from the literature what good governance means in the context of biobanking. And we found that 3 characteristics seem to be necessary, although of course not sufficient, to ensure good governance in biobanking. So transparency, accountability, and oversight. These were, let's say, the main categories that drove our study. So what we found is summarized in this table is a number of mechanisms that biobanks adopt. I have to say we relied exclusively on primary information available on biobanks websites, and when needed, we interacted with individual biobanks for additional or information or clarification. So what we found is a number of governance mechanisms that we categorized under 6 broad rubrics or domains. And I will go through them briefly in the next few slides. So we found out that most biobanks in our study adopt communication strategies to describe their activities and also their governance structures, mostly via their own websites that, as I said, include some elements of general governance principles for the biobank, some stories, some accounts of the kind of research that is performed by the biobank, but also communication strategies include the organization of open days and workshops to engage both the research community and the wider public with the activities of the biobank. The second domain is compliance, as you might have anticipated. Compliance refers to the effort that the biobank makes in order to abide by relevant regulations, for example, the GDPR in Europe, but also to comply with codes of ethics and with some specifics on describing sometimes explicitly compliance mechanisms that are adopted by the biobank. So in this respect, there is an effort on the part of biobanks, at least in our study, to show how compliance is ensured by the biobank. The third domain is expert advice, and there is a lot of information about this. So most biobanks seems to be adopting advisory committees to deal with both ethical and technical issues, but also to advise the biobank on scientific strategy, coordination, and management of the biobank itself, but also management of data and biological resources. Research participants tend not to be included in advisory committees, but they seem to have a role in those independent ethics bodies that also biobanks rely on, most of the biobanks that we have analyzed. External review is another domain. So all of the surveyed biobanks have received an approval by a research ethics committee prior to their launch, but also undergo regular external audits. And of course, the research projects that seek access to the resources of a biobank also undergo independent ethics review. So there is an effort on the part of the biobanks to show that there are some external oversight bodies that look after what the biobank does. Another element that emerged from our study is that, of course, most biobanks tend to have internal procedures to ensure the, let's say, the safe and effective administration of their activities. Of course, this is important to ethics. Informed consent, mostly in the form of broad consent, is, let's say, the cornerstone of the internal procedures that allow a biobank to exist in the first place. But also, most biobanks show details about how data and samples are stored, how security is maintained, how access is provided to external researchers, and also what quality controls and standard operating procedures are in place. Finally, partnership is another way in which biobanks show, let's say, their accountability and their commitment to good governance. In particular, smaller biobanks tend to be members of larger networks, and this goes in the direction of making their resources more visible and therefore more accessible, and also it helps them enhance their quality standards and their capacity to comply with legal and data protection regulations. So this is more or less what we have found out. There is a big variety of mechanisms that biobanks adopt to show how they are committed to good governance. Of course, our study has some apparent limitations. First of all, we only relied, well, mostly relied on publicly available information that needs a caveat. So whenever we were not able to find information about governance structures, this is not a proof of the absence of such structures. It's just that these structures are not visible, to at least to our eyes. So there might be more that we were not able to see, but other studies, of course, can go in the can attempt to have a more fine-grained account of those governance operations of biobanks. But our results resonate with similar studies already published in the literature. So the bottom line that we feel confident in drawing from our study is that most biobanks make at least some effort at being transparent about their governance. That the focus, though, is on showing that their operations are legitimate, so that they meet ethical, legal, and technical requirements. Less attention is provided to show publicly how the biobank is accountable to stakeholders and what precise oversight mechanisms are in place. Again, I have to stress this because I don't want to overstate that, or I don't want to be overinterpreted. We're not saying that there are no accountability mechanism or no oversight structures in biobanking. We just say that they are less visible from our data, at least. So basically, this led us to like a follow-up small paper on this aspect. So we realized that there is an additional effort that the biobanking community might have to do in more clearly describing and illustrating and promoting their governance structures, especially in terms of accountability and oversight. We provide some reflection in this paper on how this could be done, for example, by tailoring more specific communication strategies to a wider array of stakeholders, probing how they are perceived by their stakeholders, and clearly defining the aims of any initiative that could be devoted to improve transparency about governance. So since we have detected this, let's say, less visibility as to the oversight mechanisms of biobanking, we thought that this resonates with our ongoing work on what we call systemic oversight. This is like 1 to 3 papers on the topic for your reference if you are curious, because as I said, I won't have a lot of time to really dive into this right now. But in our lab, we have been working on this systemic oversight approach that basically stems from the realization that health data is expanding. There are additional sources that are coming into play. Some of them have to do with environmental data, lifestyle data, and behavioral and social data as well. Our technological capabilities to collect and analyze data is expanding as well. Think about artificial intelligence, for example, as a big data health research technology. And of course, the panel of stakeholders involved as this data ecosystem expands is also growing. So we basically came up with a number of, first of all, we tried to understand what problems this expansion of the health data ecosystem implies. And of course, it implies problems about the difficulty or the uncertainty in clearly defining why data is being collected, who has access to data, for how long data is going to be collected, under which conditions, and how new practices around the analysis of big data can actually start, let's say, grouping people in new categories. So what is the effect of big data on the research participants, so to say? And so our systemic oversight approach draws on adaptive governance as a model for governance, and it basically consists in a set of 6 high-order oversight principles that apply across the board in the domain of data-intense health research. These are the principles that make up the acronym, of course: adaptivity, flexibility, monitoring, responsiveness, reflexivity, and inclusivity. And in the last few minutes I will briefly provide some illustration of what we mean by those principles. Okay, here is the how the acronym is formed. So adaptivity refers to the fact that oversight mechanisms need to be designed in such a way that they can accommodate new types of data and new uses of data. Flexibility instead refers to the capacity of oversight mechanisms to treat data depending on their actual use rather than on their source. For example, we are used, for example, to think that genetic data is more requires let's say a higher level of oversight, and this is for sure justified. But there might be other ways, other types of data that can have the same kind of risk profiles in terms of, for example, of risk of identification, stigmatization, and discrimination than genetic data. So the idea would be to be able to take into account what actually people are doing with data rather than looking at their source alone. Monitoring consists of, it's basically about planning for continuous oversight activities so that we are able to detect in which respect data subjects and research participants become vulnerable due to new data being collected and new data being analyzed in novel ways. Responsiveness is sort of the other side of the coin, so being able to prevent those vulnerabilities and containing the effects when some problem arises, for example, a privacy breach. The last two, I've said already something about this. So reflexivity is really about being able to anticipate the way in which new classificatory practices enabled by big data affect communities and individuals, especially in terms of stigmatization, in terms of categorizing people according to risk, health-related risk, and how this can impact individual and community identity, for example. And finally, inclusiveness is a principle that in the biobanking community has been discussed for a long time, and it's about promoting active upstream engagement of relevant stakeholders, including lay publics and underrepresented stakeholders. So for example, in this case, a good example is the All of Us research cohort that made a conscious effort in including, actually in overrepresenting communities that traditionally do not contribute to health research, not because they don't want to, but because they are not, so to say, captured by that. Okay, so this is a leftover. Okay, so the aim of this approach is to produce a common ground for a variety of governance actors and activities. Now, let me jump to the last bit of my talk, just a couple of slides more. So my concluding thoughts on the journey we have made together so far. So I've said at the onset that biobanking, in my view, is evolving. Now we can ask, is this evolution like a rapture? Is it a burst, or it's a gradual form of evolution? So it's like, is it, yes, a gradual evolutionary trajectory we are witnessing, or is it instead like a jump, an evolutionary jump that we are seeing? Well, as I said along the way, in the biobanking community, we have been discussing for a long time issues like data sharing, for example. So we know what the trade-offs are. This is a paper we published a couple of years ago on data sharing for precision medicine, and basically we show what could also be anticipated. So if we look at the data sharing guidelines at the international level, what emerges is that the areas that are most frequently discussed are participants' autonomy, so informed consent, privacy, and data quality and curation. So in the biobanking community, I think that we were aware of that from the beginning. So in a sense, what this prompts me to say is that there is nothing new under the sun, meaning that probably this evolution that I'm seeing is something that has been taking place for a while, at least, in the biobanking domain. And this is because the biobanking community has long been dealing with ELSI issues around data sharing, to the point that it has created governance structures that of course can be improved, as our studies shows, but they are overall trustworthy. So we don't have a negative outlook of the quality of governance in the biobanking world, for that matters. So in this sense, my bottom line here is that really biobanks can have a greater role to play in data-driven research, and also in data-driven public health response in the context of the current crisis. So I'm a bit appalled by the fact that the data-driven response, public health response to the present crisis, is basically being tendered to private companies like Apple and Google, that they're doing an egregious job, but it's a bit shocking to see that the infrastructure that is already there, for example, in the case of BBMRI, I think this infrastructure could have a greater role. And of course, it's not a matter of willingness on the part of BBMRI, but it's a matter of how we understand that what we have constructed in the last decades around data collection and sample collection can turn useful now, and the experience that this community has been gaining for the last few years can turn out useful. Of course, we need more specific governance principles for this, and we try to contribute to this transition. I mean, our little contribution is this oversight principles that I've discussed. But of course, there is more work to be done, and more conversations to be had in order to reach the efficient level of data and sample use and sharing that we all wish would become reality sooner than later. So that was my last thought. I thank you very much for your attention, and I'm of course more than happy to listen to your comments or answer any question. Thanks a lot.
Thank you so much, Alessandro. And we have a couple of questions in the chat. And I would like to pick one out where the question is as regards to larger networks and motivation. You mentioned that biobanks have the motivation for it. So the question is, what do you think, also based on your data, what is holding them back?
Thank you. That's an interesting one. Well, I think that on the one hand, it's let's call it a cultural problem. So there needs to be incentives to let's say to create a federated environment around samples and human data. In the US, of course, it's early to judge whether the US is going to be successful with the All of Us research cohort. But in the US, there was a strong effort from the center, so from the apical positions in the political administration and from NIH, which is arguably the most important research institution in the country, to actively create from scratch a big national cohort. In the case of existing small cohorts that need to be included in a federated organization, as I said, there is an issue of culture, so there might not be sufficient awareness of the advantages of joining larger networks. And then there is the other elephant in the room, that is interoperability. So interoperability of data, of course, of formats, but also of procedures for handling samples and so on. So the point is that there is a cost associated to sharing resources, and it's a technical cost. And we know that a lot of efforts have been done to improve interoperability, but a lot has to be done still. So probably there are these two elements, the cultural element and the technical element, that are playing, so to say, against more expanded levels of integration.
Thank you indeed. That allows to pick out another question on what are the implications with regard to transparency and accountability, especially for future-proofing broad consent. And given that the research and its possibilities are developing so quickly, I mean, we've heard already genomics and AI, of course.
Yeah. So I think that we've done a lot of progress in the domain of informed consent. Now, broad consent forms are, let's say, standardized in different countries in different ways, but it's more or less a reliable piece of the infrastructure, broad consent. What I think is where I think there is still some room for improvement is so in the context of public health, for example, as you also point out in your paper on BBMRI, there are exceptions to the requirements of informed consent within the GDPR. So there are certain data that can be collected and used without informed consent if the reason is a public health emergency. And I think that we need to make people understand that they don't have to be overly protective about their data if they are used responsibly and for the common good, so to say. I've seen in the case of digital contact tracing, a lot of emphasis being put on individual control on data, on privacy preservation, privacy by design, privacy by default. But then if you look at the informed consent practices for digital contact tracing apps, they are, well, if I may say, they are pretty ridiculous. So basically you just click on a terms of service, you accept it as you do for any other app. So there is a lot of work to be done. On the one end, to make people understand that they don't have to be overly protective of their data if they're used responsibly and for the common good. And on the other end, we need to understand how can we do better in terms of meaningful informed consent, especially in the digital world. I think that in that area, we still lag a bit behind. We need to improve on informed consent, let's say in the broad domain of digital health.
I think this is a fascinating statement because it embeds the informed consent as one mechanism in the broader governance of biobanks. And also in my humble experience, I share what you found with your excellent data, that there is so much more that biobanks are actually doing, but is not known publicly because it's not talked about. That doesn't mean it does not exist.
Yeah.
This brings me somewhat to the methodology that you put in place to come to the principles, because when we observe the shift from samples and data more and more to data and samples, how do you find, especially for Affirm, the principles, and did this process also involve societal actors and their expectations?
I will start from the last part of your question, Michaela. The straightforward answer is no, because we are still, let's say, at theoretical level. We are still so the principles came out from our let's say bioethical analysis of the challenges of data intense health research. Of course, we are planning to, let's say, validate this framework, and the paper on future-proofing biobanks governance was a first step into saying, okay, let's see what's out there, and let's see how it relates to what Affirm tries to do. So we are planning to test or validate these principles, and certainly we're gonna do that in conjunction with a lot of input from stakeholders, but we haven't done it so far. So the principles are, let's say, a theoretical elaboration or a scholarly product so far, but we are in the process through a number of projects that we have. We are in the process of validating them, so to say, or receiving feedback on them, for example, by regulators, by people in the domain of translational medicine, and people involved in initiatives that have to do with making data available for research, and hopefully in the future also with patient representatives and research participants representatives, so with more specific clinical community, if you want.
It's fascinating to see how much aspects are in the governance of biobanks, and I'm constantly fascinating how all of us are not yet digital natives, so to speak. So I'm sure that even among those in the audience who use whatever apps on their regular phones, with some you have confidence, with others you don't care because it allows you to connect to your families, with others maybe some of the COVID apps you're a bit more careful, up to suspicious. but I would speculate that hardly anyone has taken the time to fully read the terms and conditions of all the apps that are out there and to make the connection. But what we see is that this element of trustworthiness also feeds in with usability. And I'm intrigued with your arguments that in some sense we have to think and reconceptualize what the usability of infrastructures in place for pandemics like the one we live through means today, and how that can shift how we understand infrastructures and the governance of infrastructures and biobanks.
Yeah, no, I totally agree. I mean, the issue of trust is a very tricky one because, as you just said, we all use a lot of apps on our phones without even asking ourselves whether, I mean, how our data is being collected or used or given to third parties. When it comes to health, it's true that people tend to be more skeptical. They want to see more, but I still find it quite hard to explain how people trust, for example, digital means of payment without even questioning them, and instead they need a lot of reassurance as to the use, for example, of digital contact tracing, which is way less invasive of privacy and way less dangerous, so to say. And by the way, it might have a public health benefit attached to it. I would say that trust is also something that depends on regulators. So in a hopefully near future, where regulators will have understood how to oversee the development and the release of digital health applications, hopefully some of the current skepticism will be overcome. At the moment, regulators themselves are still trying to figure out how to assess those applications and how to monitor their use by individuals. So it's a little bit the same thing as that we are seeing in the case of COVID vaccines. So a lot of people are skeptical about vaccines. Personally, I'm not, of course, I want to say it clearly, but skepticism will fade away if people trust the role of regulators in the development of vaccines and in putting safe and effective vaccines on the market. So it's not a matter of simply showing ordinary people the published data. This is already available. I mean, but I doubt that ordinary citizens will have the instruments to even go through I don't know, the last paper in the New England Journal of Medicine about a candidate vaccine. The point is that you have to trust regulators and their work. So you really need it's at that level that public trust is built and reinforced.
I could not agree more that the trust and trustworthiness is something worth keeping, and only with your last remarks, let alone your excellent talk, we would have many more topics to dive into. For the sake of time, I can only thank you for your presentation and your excellent talk in the name of all the attendees. And
thank you.
Pleasure, and hope that we can connect in the future to future-proof the biobanks even better as they are there now. Thank you, Alessandro.
Excellent. Thank you very much indeed, and thanks to everyone who dialed in to follow the seminar. Thanks a lot.